Ya. Ya. Oh. Ni grup mana ni? Ni grup mana ni? Ha?
Group 1.
Berapa orang?
10.
You find 10 orang ya? 10 orang ya? Y5. Group 2, 10 orang juga. Bukan 6 I tengok kita dah kurangkan dari 6.
Group 1 10 orang je.
Group 2 berapa orang?
Untuk group 1 10 orang.
Dia 3 group kan?
3 group.
Blok you blok 1 kan?
Ke, Prof?
Tak, you blok 1 kan?
Blok 1.
Blok 1. Lepas tu blok 1 group 1 10 orang. Group 2?
Ya.
10 orang juga. Group 3 10 orang juga. Ya.
9.
9. Ramai ya. 30 orang satu blok 1.
Ya.
30 orang.
28.
Berapa blok
28 orang.
Berapa blok semua sekali you ada? 3 blok.
5 blok.
5 blok. 28, 5, 140. 140 ya. Boleh ke you all ni 140 ni? Banyak sikit lah. Macam ni year 5, year 3 semalam 3 orang je. I betul orang dah suruh turunkan you all ni jadi 6 orang satu ni. Tak apa. Siapa nak present? Ni menilai mana? 2, 4, 6, 8, 10. Mana lagi? 9. Mana sorry? 2 orang lagi?
For group 1 dah complete dah 10 orang.
1, 2, 3, 4, 5, 6, 7, 8. Hazira mana? Hazira. Musliha.
Ni Dr. Hazira.
Bising ya. Sistem tak bagus ya. Okay, siapa nak present?
I'm presenting the first case.
Angkat tangan siapa? Tak nampak.
Can you hear me?
Dengar siapa presenting? Hazira. Okay, present.
But sorry doctor, because here are raining heavily, so I think I need to turn off my camera because the signal is not so good.
Ya, kat mana tu?
Ya, dekat Rompen.
Kesiannya lah. Tu yang makan udang galah depan orang tak nampak.
Tak kadang-kadang.
Udang galah kat sana Rompen tu kan, dia orang bela ke atau dah tangkap?
Ada yang bela, dia tangkap. Tapi kalau tangkap tak banyak sangat dah sekarang.
Ya. Sekarang dia orang bela lah.
Ada yang bela kat sini.
Bela kat mana dia orang bela?
Ada dekat Lebar Condong, ada satu kedai udang galak besar jugalah. Boleh lah.
Dia bela, tapi dia ambil kat mana? Dia bela kat mana dia udang galah tu?
Bela dekat memang kolam rasanya.
Ya. Ada beza tak rasa yang bela punya dengan yang original?
Lain sikit lah. Kalau yang ori tu dia macam, rasa dia macam manis lagi lah, lagi best. Kalau macam yang bela tu macam tak berapa sangat lah.
Kenapa dah tak banyak tangkap lah sekarang?
Tak tahulah, mungkin dah kurang ke udang galak. Tak sure.
Ya.
Tak banyak sangat.
Pollution ke? Apa ke? I pergi hari tu nampak kecil-kecil udang sekarang. Kan?
Dah kecil dah. Tak banyak sangat.
Dulu tak macam dulu. Tak apalah. Okey lah, present lah.
Okay, so
you tahu ke Rompen popular udang galah? Tak tahu? Kesiannya orang muda ni. Tak tahu pasal tu je. Okey cerita
Okay, so for my chief complaint, RN, a 1 year, 8 months old Malay boy, toddler, was admitted to HTAA with a complaint of fever for 6 days duration. He was apparently well until 6 days prior to admission when he started to develop fever. It was sudden in onset and continuous fever. It was associated with non-productive cough and runny nose, but his mother described the nasal discharge as watery, clear and minimal in amount. However, it was not associated with chills and rigor. No documented body temperature recorded at home, and it was not relieved by syrup paracetamol. 3 days prior to admission, the mother noticed that his son's lip became cracked and also dry. She noticed that his lip turns into bright red in color, and his tongue also became red and swollen. There was abundant distribution of raised small dots over the red tongue, just like a strawberry appearance. It was not preceded by whitish spotted tongue. Other than that, he also had swelling of both hands and feet. It was preceded by diffuse redness over both of his palms and soles. There was skin desquamation present around his fingernail and toenail area. Mother said that his son refused to walk and he refused to hold object in his hands prior to these symptoms. Nevertheless, there was no history of recent fall or trauma prior to the symptoms. Besides that, patient also developed bilateral redness of eye. It was painless as he can open and close his eyes normally without crying. There was no eye discharge, no frequent rubbing of the eyes, and his eyes was not sensitive to the bright light. 1 day prior to admission, patient had 2 episodes of non-projectile vomiting. The amount was half cup for each episode. The vomiters contained of fluid and food particle, but it was non-bilious and no blood noted. It also associated with loss of appetite, but no apparent weight loss, as he refused to eat his regular meals and only consumed breast milk and also plain water. He's looking lethargic as he became less active than usual. And her mother did, regarding the muscle and joint pain, the mother did not sure regarding both of the symptoms. Otherwise, there were no rash noted around the body area, no redness or induration at his BCG scars, no skin peeling at genital area, no neck swelling noted, no abdominal pain and diarrhea, no shortness of breath and also wheezing, no yellowish discoloration of skin, mucous membranes or sclera, no flushing of cheeks, no history of contact with the sick people, no recent history of jungle trekking, water activity, and their housing area is not dengue prone area, and he has normal urinary and bowel activity. So due to this unresolved fever and his worsening condition, he was brought to emergency department of HTAA. Blood sample was taken and urine done. Temperature recorded was 39 Celsius. After that, he was admitted to the PITS ward for further management. Okay, first, that's for my history of presenting illness.
Okay, siapa lagi present? Okay, Anwar present pula.
Okay, for my case, a 1 year, 2 months old Malay boy with no non-medical illness was admitted.
1 year, 2 months.
1 year, 2 months. Malay boy, no non-medical illness, was admitted to pediatric wards of HTAA with worsening cough 1 day prior to admission. Okay, so the history started 1 month prior to admission, in which he had mild non-productive cough, which is associated with difficulty in breathing. It is also associated with fever, and the temperature documented at home was 37.8 degrees Celsius. But however, there is no chills or rigor, and there is no night sweats. He was brought by the mother to GP, and he was nebulized. The blood investigation was also done and came out as normal, so patient was not given antibiotics. He was given rectal paracetamol and cough medication, but however, the symptoms persisted, requiring patient to be nebulized 4 times within that 1 month. 1 week before he was admitted, the cough worsens, in which it became productive, yellowish to greenish sputum. It was also associated with post-tussive vomiting, but however, there is no barking cough, no whooping cough, or prolonged bouts of cough. 3 days prior to admission, his symptoms worsened, in which he started vomiting out yellowish mucoid content, but however, mother denied any blood in the vomiters. It was also associated with loss of appetite and loss of weight of 2 kilograms in a week. He was also noticed to be less active, and there is reduced urine output and no bowel output. But however, there is no foul smelling urine, no blood in the urine, or loose stool. Okay. One day prior to admission, he presented with noisy, rapid breathing and nasal flaring during sleep. But however, there is no chest indrawing noted by the mother. Because of these symptoms, he was unable to sleep well. So mother brought him to emergency department of HTAA, and the temperature documented there was 39.8 degrees Celsius. He was then admitted to ward for further investigation and management. He had a history of sick contact with his grandmother, who is having upper respiratory tract infection. But otherwise, he has no history of recent traveling, no history of visiting crowded places or water activities. The house area is also far from car workshop or factory, and mother also denied any contact with a TB patient. He was admitted 7 months ago due to lung infection for 5 days and was on antibiotics. He was allowed to discharge, and mother claimed the condition improved after finishing the antibiotics given. That's for my history of presenting illness.
Abdullah, what difference between the first case and second case?
Can you repeat again? I'm sorry.
What the difference between the first case and second case?
The first case, I think, more acute, and then the second case, more to chronic cases.
Amirah?
The first case, the second case has other associated symptoms like rashes, swelling of the hands and the feet. But the second case is more towards respiratory symptoms only.
Hani?
For me, the first case is more acute and second is chronic. And
Dah
also,
mention dah. Abdullah dah mention dah. Share idea lain lah.
the age,
Age apa? First case apa?
first case is 1 year and 8 months, and the second case is 1 year and 2 months.
Faiz?
Okay. So the chief complaint, the first case is fever, while the second case is worsening cough.
Second case ada fever juga kan?
Yes.
Then what's the difference? What's no difference?
In the first case, there is red and swollen tongue with swelling hands and feet, while the second case is more related to the respiratory, like shortness of breath.
I mean,
First case, it's noted there's no history of previous. I mean, the first case, there's no history of admission of a similar symptoms because he was admitted for neonatal jaundice. However, the second case, I mentioned he was admitted 7 months ago due to a lung infection.
Safia.
For the first case, it shows that the patient
You gantung apa? Belakang tu gantung kain ya? So terabur lah. Sepah kat belakang lagi. Tak, tak sepah. Okey lah. Apa? Mesti apa? Apa beza?
the symptom shows that patient having a persistent symptoms, while the second
What you mean persistent symptom ni? Explain a little bit.
because patients have fever for 6 days without relief.
First case, persistent symptom. Which
And
one? The second case persistent symptom juga lagi lama.
Second case
4 minggu.
show some worsening symptoms. Because at first
Di first case tak ada worsening lah. Artinya dia progress tapi dia tangan bengkak, tu bengkak, mata ni. It's not a sign of worsening. It's just a new symptom.
Okay lah, the second case confined to the respiratory symptoms that affect the other system, like a systemic manifestation like lethargy, loss of weight, loss of appetite. But for the first case, it is the presentation is systemic. In that,
Lethargy is not systemic.
lethargy is systemic.
Systemic. Lethargy apa?
Systemic manifestation.
Lethargy is systemic. Second case lethargy.
Yes. But for the second case, it started with a respiratory system, and as it worsening, it involved the systemic manifestation.
Nurul?
The first case, no sick contact. The second case, history of sick contact with the grandmother.
The first case?
The first case, no sick contact reported. The second case, history of sick contact with the grandmother.
Fazira?
Yeah. For the first, it's associated with
Apa associated?
both of the case have a fever and also
Kita nak
fever and
difference.
also
Asking you difference. I don't ask you about the same thing.
For the first case, it is associated with the appearance of physical features such as swelling, obvious swelling, lips crack and dry. But second case, the symptom is just involved. It's not associated with the physical features punya appearance. So for example, fever, cough.
Cuba explain pula macam mana? First case.
For the first case, we can see there is a manifestation of the physical features punya symptom. For example, swelling, redness, cracked lips. Okay, for this red tongues and so on. For the second case, it is more towards the symptom itself, such as fever, cough, with not manifestations in the physical features.
Muslihana? Siapa Muslihana? You kat mana? Wah, Belakang macam dekat betul ni ke dekat betul dekat mana tu?
After morning walk.
Wah. Tak hujan?
Bawa adik-adik.
Tak hujan ke?
Hujan ringan.
Bawa walk juga?
Bawa juga adik nak.
Oh, penting adik ni. Kalah belajar. Tell me what's the difference?
For me, the difference is with the first case is more direct and simple compared to the second case, which is more complicated.
Why you say the first case more simple and direct?
Because based on the symptom, it suggests more. It suggests of infective, yet not it's and
Yeah, right.
I mean, in terms of the management letter.
We're not talking about management. You have listened to the history already.
Yes.
Now you have to tell us your opinion regarding the case, first case and second case. What are the difference?
Okay, the first case, there is the first case, there is no cough symptoms, while the second case have worsening cough symptoms.
Okay lah. Afiqah, which one you think more severe, the first case or second case?
In my opinion, it's the second case because it's more of chronic compared to the first one.
You mean the first case won't have anti-heart failure, die?
But I'm not sure that.
Why you say the second case more severe?
Because it's affecting the respiratory system. So patient might be, if he was not brought to the hospital immediately, he might because he had respiratory stress, so he might be dying if he was not brought to the hospital immediately.
You mean that the first case they bring to hospital, nothing will happen? Huh? Asking you. Cannot. Unable to answer.
Unable to answer, doctor. Sorry.
You said the opinion kan, you the doctor kan. Kata dua case datang together in the A&Es. Which one you want to attend? Amira, which one more severe?
In my opinion, the respiratory one, the second case.
Why you say that?
Because there is a high chance of respiratory cardiopulmonary respiratory complication.
Why you say high chance?
High chance. Because if based on my limited knowledge, the epidemiology for respiratory failure for children is high in pneumonia.
We're not talking about epidemiologists. We're talking about the patient now and then. You saw your patient now and then. But, we're not talking about epidemiologists now. What you think?
In terms of the severity, but
The severity.
because in the second case, the patient shows poor oral intake, so the function is decreasing.
It's just poor intake only. You can decide the patient is severe.
not only pull or intake, but we can see as the function like for respiratory severity, we have to look at the ability of the patient to respond to us, either with sentences or with words.
How you assess severity in respiratory case?
We
tell me the assessment.
The respiratory based on ability to the speech, if it is in words or in sentence, it can be mild to moderate. If it's
Dia tak ada mild to moderate. Okay, Hani.
okay.
Oh, lega lepas ya. Hani. In assessment
Yes.
of any severity, just 3 je, mild, moderate to severe. Tell me how you do assessment in respiratory case. Mild, moderate to and severe. Dia tak ada mild to moderate, semua tak ada. Mild, moderate, severe.
Check the
What the parameter?
according to the age.
Age.
For the respiratory rate, and then look for any use of the accessory muscle.
Lagi?
Any chest resuscitation. Okay. First we look at the breathing. How they talk.
Breathing first. You look at breathing first.
Breathing.
Siapa ada pediatric protocol depan dia? Cuba buka, tengok assessment ni, asma, severity asma. Roughly boleh pakai that one.
Of the severity of asthma, we
Ah,
divide it into
severe-
mild, moderate, and severe. Based on the first is breathlessness, whether it is when walking, talking, or during the rest. Whether patient have able to talk in sentences, phrases, or word, or unable to talk. Alertness, maybe agitated, usually agitated, or another for severe also usually agitated. And then respiratory rate, for the mild, it might normal to mildly increase, moderate increase, and severe is mildly increase. And then the use of accessory muscles, in the mild is absent, in the moderate is present but moderate, and then in severe it is severe, the use of accessory muscles. And then presence of wheezing, in the mild it is moderate, in the moderate it is loud wheezing, and severe it is usually very loud. And then also we look at the SpO2, pulse rate, and also peak expiratory flow rate.
So far is what your assessment, mild, moderate or severe?
So in this patient,
on the second case,
in this patient, I think he is I think moderate because patient has low oral intake.
susahnya lah. Apa Hazira, the first one apa?
First one is shortness of breath.
Tak, the first one.
Sorry?
Siapa present tadi yang siapa yang present apa tu? Peak protocol tadi? You.
Me.
Apa the first parameter?
Breathlessness. You find
breathlessness
walking?
tak dia? Faiz.
Yes, there is rapid breathing.
Ya, tapi condition apa? Mild apa?
Mild when walking, moderate when talking, severe at rest.
This one?
This one?
Tak tahu. Tahu ke tak tahu?
I think at rest.
You think at rest?
Yes, because the patient.
You present this case. What do you think?
In my opinion, it's moderate.
No,
Yes.
ada breathlessness tu. The first parameter.
I think it's moderate.
You faham tak? At rest, walking, or which one? Si presenter pun tak tahu.
Because the patient has feeding difficulties in which he
No, I
refused
tadi
to.
first parameter saja I tanya.
First parameter because for infant
Dia infant ke?
Toddler.
The second parameter, Hazira.
Talking in sentence, phrases, or words.
Tak tahu. Which one agak-agak di 1 year 2 month, I don't think we can ni. Third parameter,
Alertness, agitated, maybe agitated, usually agitated. For moderate and severe, both usually agitated.
Empat, lagi ada parameter?
Respiratory rate. Normal to mildly increase, mild, moderate increase, and mildly increase severe.
Afika?
For this patient, the respiratory rate is moderately increased.
Third apa? Apa lagi parameter?
Accessory muscle use. Absent, present, which is moderate, or present severe.
Afika?
For my patient, he has no subcostal recession or any chest recession, but he has nasal flaring.
Nasal flaring tu using extra muscle, nak using extra muscle. Tak tahu. Lagi? Apa lagi parameter?
Then wheezing.
Moderate,
loud, or very loud.
Wheezing,
moderate, loud, or usually loud.
Saya tak tahulah because the child probably we don't know asthma or not asthmatic. So what you think, Faiz? Mild, moderate, or severe?
For the first and second parameter, I think it's difficult to assess because the patient is still small. For the third parameter, which is
or because presenter unable to tell us properly. Did the presenter have that in their mind when they present the case? If the presenter has them in their mind, what in their mind about that thing, would you think the presentation will be a bit different?
I think if presenter...
that's how we assess you all. If you, because you only present what is inside your mind. If you have that things in your mind, surely you're going to present to us. But you notice the patient is lethargic, is it? Lethargic lagi. Feeding tak patient tu? Muntah, start vomiting, is it? Start sun, feeding nak tolerate. Lagi? I tak tulis, I boleh ingat semua. There is a nasal flare, is it? Child is stuck in neck. Why is it tengok, I duduk relax macam ni, I can still apa, duduk relax je. Tapi macam mana I boleh minum-minum, tapi I boleh remember those things. Why? Why is it? Because my brain looking for it. Patient can be with shortness of breath. One history of unwell for the past 1 month. My brain already dah, inside my brain dah come all the things that I should search. Just that thinking now. Because I know what I want to look at. I know what is not completed, what is a complete. Budak tu sinus tak? Dia mak beritahu color dia tukar tak? Afiqah?
Tak ada sinus, no cyanosis.
Another important aspect in terms of severity. I mean, you think that patient severe or not? The first case, how severe the first case is?
First case, in my opinion, I believe it's severe. For me, it's severe because it's.
Why is it severe?
Because it has the patient has presented with systemic involvement, and the fever has been ongoing for the past 6 days, with no treatment seek prior to it.
First case.
First case, the fever case.
For how many days?
He has been having fever for the past 6 days. And he has manifested along the progression, he has manifested in systemic manifestation where he has swelling of the hands, the cracked lips and dry lips, and he has bilateral redness of the eye and also episodes of vomiting. So I believe it has progressed to severe.
Is it a sign of severity or sign of the symptom of the disease start to come out?
Sign of the symptom start to come out.
Then why you say severe?
Because
you mean that if the patient got swelling of the hand, rash, you mean that the disease become more severe?
No, it's manifestation of the symptoms.
I don't know. What you think of?
I think it's the manifestation of the symptom. It's just for my opinion is that because the mother for me.
So is it adequate to tell me that when the presence of the presence of this other sign and symptom, the emergence of the other sign and symptom, it means that the disease is more severe?
Maybe not. Sorry. Maybe not severe yet.
So why you say the patient is severe?
Maybe because from my perspective was that because the prolonged ongoing of the fever with no treatment prior to it, and because in these cases if it's systematic manifestation, it can lead to a further complication if it's not treated promptly.
Okay, you're talking about further complication, but talking about now. Safia, what do you think?
I think it is severe as it affects his appetite, and also he's
What you
become,
mean affect the appetite?
because poor feeding may lead to severe dehydration, and he also already have 2 episodes of vomiting. So we need to assess the severity
How bad
of
it affect the
dehydration.
poor? How bad they affect the feeding? Tell me.
How bad?
You have to poor feeding. What you mean by poor feeding?
So feeding less intake compared to.
Yes, I know what you mean by poor feeding. I mean, child taking 4 ounce, not taking 3.5 ounce, 3 ounce, decrease in feeding, but not too bad. The child take 4 ounce, not taking 1 ounce, 2 ounce. This mean that feeding is very bad. So what you mean by poor feeding is this child? Don't know.
Not sure, but I'm concerned about the dehydration. Because
How? Concerned about dehydration? What you worry about dehydration?
Sorry?
Why you worry about dehydration?
Because he is presenting
Yeah,
with
this case what does yeah?
because of
Huh?
poor feeding, adding up with vomiting. So I like to further assess.
How bad the vomiting is? Tak tahu.
Not sure.
Tanya Safia, Hafiz Hazira, how bad the poor feeding is, how bad the vomiting is?
So for the poor feeding, there is loss of appetite but no apparent weight loss. He only refused to eat his regular meals but still consume breast milk and also plain water. For the another one, vomiting, he only have vomiting 1 day prior to admission, 2 episodes with the half cup for each episode. Vomiters consume fluid and half cup for episode, only 2 episodes 1 day prior to admission.
So is that enough to indicate to you it's very severe, Safia?
But he's also complain of lethargy, which means that not enough feeding.
Not enough feeding or because of the illness?
I'm not sure.
What do you think?
It could be both.
It could be both. How you want to know the child is having adequate feeding, drinking water?
By assess
Not for history.
whether he is always sleeping and refuse to wake up.
If the child is having meningitis, it will present like that. Any CNS infection will present sleepy, like sleeping to wake up. How you know that the child is not having adequate fluid?
Looking at the urine output frequency.
So Hafiza, what about urine output? Hazira? Urine pattern and urine output.
Output is normal.
Normal?
Normal.
So lethargy due to what?
Due to the illness.
So anything else you think about the patient severe? Macam mana patient dia taji bila drink breast milk? Patient dia taji tapi drink milk. Very well. Very well kan, drinking milk kan. Minum air well kan.
You can consume breast milk and plain water, but cannot eat food.
Tapi dia ditaji kan. Dia
Less
ditaji.
active.
Nak aktif ke ditaji?
Yes. Less active. Less active.
Tak faham apa less active apa?
Less active than usual.
Usual, ditaji or not?
Less active than
Ditaji or not?
Yes, according to the mother, yes. Looking lethargic.
Looking lethargic. But still drinking.
Yeah.
Apa tu? Hungrily. Your output still good. How you argue on that? Nurul, what's your opinion?
Opinion regarding which case is severe or the first case?
Your friend also said that the second case is also severe. The first case is also severe. What's your opinion?
I think the second case is more severe.
The first case. They think also
case.
severe. The child still fully conscious, some lethargy, some less active, feeding slightly decreased.
But in the first case, apparently it looks like the hemodynamic status is stable.
Looks like? What you mean looks like?
In terms of the sign and symptom.
Apa benda yang sign symptom tu?
From the history, the hemodynamic.
Apa benda yang dia cakap dia kata dia orang stable tu?
That that there is no reduce in the urine output, and then there is no compromise in the breathing.
Why you think the child going to have compromise in the breathing?
In case of if there is hypotension.
Why you think the child should develop hypotension?
For example, if it is in the sepsis cases, can cause septic shock.
Okay, septic shock and hypotension. Okay. So, your conclusion?
My conclusion is the first case is not severe.
Not severe. Mild je lah.
Mild.
But you not worried temperature at 39 degrees for 5 days, 6 days.
Yeah, the fever is something to be concerned of.
But still not severe enough. You pernah rasa ke you temperature 39 degrees for 5 days?
Tak pernah.
Tak pernah. Lepas tu you tak rasa very bad dia. You rasa tak ada apa, biar tak apalah. 39 degrees for 5 days tak severe.
Yeah, fever 6 days severe.
Huh?
Fever for 6 days severe.
How you know that this sign is what the evidence to tell you that the fever is severe? What you worry with high temperature like that for a long time?
Febrile season.
Huh?
Febrile season.
Ada budak ni?
No.
You expect the child having febrile seizure? Would you expect this child having febrile seizure?
It can
Must the child having febrile seizure?
not necessarily.
Why you don't think the child probably don't have should not have febrile seizure?
Not sure, doctor.
Huh? Not sure.
Not sure.
Any family member have febrile seizure, or the child have febrile seizure previously?
No, not reported in history.
Not reported history. Not reported means that probably it's there, probably it's not there.
Probably it's not there or not us.
Oh, yelah, not us saya. Ya, kadang you presenter dia baca history orang kan, dia tak tahulah. Other people history. Tak boleh nak marahkan dia. Last time masa present dulu, I screw lah dia orang sebab dia present dia orang tak kelak proper, sekarang tak boleh. Abdullah, do you agree with chief complaint on first case?
For the first case, the chief complaint is fever. So I think I agree because
I mean that the mother didn't worry of hand edema, rash. You think when your mother, which one the mother worried more? Fever ke, rash ke, hand bengkak ke? Which one mother worried more? Let's say you are mother, you're not mother let's say. And which one you worried?
I think I will be worried about swelling.
You'll be worried about swelling? Yeah?
Yes.
Hand swelling?
Hand swelling and rash.
Rash. Don't worry about the fever. It's okay. No need to worry about the fever.
Worry, but before going to clinic, mother will try to handle the fever on her own first.
Yeah, 6 days already. Kan?
Yes.
60 already.
Maybe the mother is also worried about the redness of the eyes.
Redness of the eyes. Mother can explain the tongue some more, is it? Redness of the tongue. So which one mother worried the most? Tapi dia kan semua-semua lah. Hazira?
Sorry, doctor. Can you repeat again? The line is not. Sorry, can you repeat again? The line is not clear.
Banyak ni excuse. Tak nak kena soal ke dia?
No. No, the line is not clear. The line is not clear.
Yeah.
Sekat.
We were discussing about the case. We're discussing why is it the mother have she complained of fever when the child got swollen of the limb, and then eyes got discharge, tongue got knee, rash. So which one is really chief complaint?
Okay, so I think for the really worried in this mother, chief complaint is fever for 6 day duration because the mother already gives the medication, but it still doesn't resolve by the medication.
I mean the
So
mother.
that's, I think the
Which one mother worry more? If you are mother more, the swollen the hand ke, or the fever?
I think for me, if I am a mother, I will
If you're
worry
mother.
for if I'm mother, I worry about the fever.
You don't worry about the swollen hand.
Because it is
fever. You see hundreds of people, thousands of
yes.
people got fever. Tapi how many child they have swollen the hand? So tiba tangan swollen. Di tangan swollen tu hari ke berapa? Before admission.
3 days.
Before
3 days prior
admission.
to admission.
The mother don't do anything.
3 days prior to admission.
Mother didn't do anything.
Sorry?
Mother didn't do anything.
Doesn't do anything. 3 days prior to admission doesn't do anything.
Okay lah, dia tak risau lah. Wah. Cool mother ni. Cool lah. Tangan anak swollen dia tak risau. Budak tu masih aktif lagi, masih boleh tu lagi lah. Drinking lagi masa tu. Not lethargy yet.
Yes. Yes.
So mana worry? Lethargy ke atau fever?
I think because of the fever that doesn't resolve by medication, also together with another manifestation, another prominent manifestation such as swelling and also red tongue and also
So
cracked lips and
which
so
one
on.
Which one you complain?
The chief complaint is fever.
Still
for
fever.
this duration.
Yeah.
According to this mother, it's fever.
According to the what? Paper you read according to the mother? Mother, you clerk this case?
No.
Then are you really clarified with mother which one you worry most? Which one you bring the child to hospital?
I'm not sure about that.
Would all mother complain about fever? Few mother will worry about the fever, or the other worry about lethargy, another one worry about the swollen of the finger of the limb. Which one mother? All mother the same. Soon worry about the fever.
No, I think because fever in the infant, it is common. But with the manifestations such as swelling, red tongue, and other.
So you mean would the mother just bring the child to the hospital because of fever, or the mother bring the child to the hospital because of limb swollen, or because of the rash? Which one?
I think because of the limb swollen and also red tongue and changes in the mucosa. In this.
She complained is why the child was brought to the hospital to see you.
According to this, it's fever.
According to this, it's fever.
I'm not sure because
You're not sure.
Yeah, I'm not sure.
You thought you're a lawyer. You don't defend your history. Macam mana you tak lawyer tak defend? You're unable to defend your own history. You must able to defend your history. Musliah, anything you want to ask? Anything you want to ask? Back to tube, is it? Musliha?
Yes, doctor. I don't have any question.
Apalah Musliha, my advice to you, you better exclude yourself lah.
Yes, doctor.
I think you dalam kereta
Yes.
I think you better exclude yourself lah.
Sorry, doctor.
Because you see, I like full commitment. Even my son also, bila dia teaching kan, kita orang semua tak pergi mana-mana or we just left him at home. You know, just tunggu kat rumah. Dan ni semua, there is, apa tu, we told our son, tak apa, it's okay, you belajar. Kita orang keluar semua, keluar balik makan, you know. Teaching is something that is not, you know, it's not contoh part time. You know part time tak?
Yes.
I expected full commitment, full thinking process. So I want you to exclude yourself from this ni. I think from my opinion, you don't take it as important. It's okay. You take it is because you know I already told. Bila I betul kelas dia will be around dah seminggu dah kan, 4-5 days kan. You bukan pergi tengok melawat orang mati, you bukan pergi melawat orang ni, faham? You bukan pergi satu emergency. You tell me suddenly, oh kita orang running around. All your friends are, you know, fully committed. So I want you to exclude yourself. I think it's a bad attitude. And my opinion, I also a parent. My son semua belajar online juga. Sekarang pun tengah belajar lagi online. Sebab dia nak SPM. Tak ada apa, no problem. I tak benar dia because my ni. Let's exclude saya. Okay.
I'm sorry, doctor.
You know, I want you to exclude yourself. I tak suka ni orang tu not committed.
Okay, doctor. Sorry, doctor. Thank you, doctor.
Okay, Afika, apa tu? No, Afika. What do you think of your case? What is the essence of your case? Cik complain apa tadi?
Worsening of cough.
Worsening
of cough for 1 day duration. For 1 day prior to admission.
Worsening of cough for
1 day prior to admission.
No, why the chief complain? Chief complain dia tak boleh. Why is it your child come to the hospital? Cough or what?
So basically he was brought to the hospital by the mother because of the noisy rapid breathing and the nasal flaring during his sleep.
What we call that?
Respiratory distress.
What we call that? Anybody? You call it a shortness of what?
Breath.
Breath, sakit ni. That is reason your child will brought to hospital. You see the cough for 4 months already dah. You see kadang kita cough 4 months kita tak admit. If your child is well, to investigate kat outpatient dia. Tapi your patient having shortness of breath. So what the chief complain?
Shortness of breath and tachypnea.
For
1 day prior to admission.
You're okay, shortness of breath for 1 day. Tak payah tachypnea. Once tachypnea, sign shortness of breath. Shortness of breath for 1 day. Noisy breathing?
Same, 1 day prior to admission.
1 day juga. So shortness of breath and tachypnea for 1 day. 1 day. That is the chief complaint. Faham? Shortness of breath, not tachypnea, shortness for 1 day. You tell me that the child was brought to the hospital because of signs evidence of shortness of breath. Second, because of the noisy breathing, is it? So
Yes.
we're going to be a shortness of breath for 1 day and noisy breathing for
Same, 1 day. For 1
1
day.
day. You see that you understand why I query about the chief complaint? You nampak tak why I query about chief complaint? Then you can present all the problems start 4 weeks ago with a history of coughing for a month ago. Start that. I mean that's when the problem start. But what's bring the child to come to the hospital to be admitted? Is a
Shortness of breath and noisy breathing.
Yes. Okay.
Okay.
Okay. Okay. What the essence of your case? Hazal ni case boring. Hazal case dah tahu diagnosis. Boring je lah. Ya, apa nak discuss the history sebab diagnosis already known. From the history tahu the diagnosis. So boring je lah. Your case. Afrika, what your essence of your case?
Essence. Summary ke?
Essence. Summary lain. Satu one sentence je.
Respiratory distress.
Tak sampai sentence. Gunakan satu sentence.
Oh, sentence. So my patient, boy toddler, was brought to the hospital due to shortness of breath and noisy breathing for 1 day.
Okay. Anybody want to repair sikit sentence tu? Make it more nicer.
I would like to try. So this is a 1 year, 2 months old Malay boy presented with shortness of breath 1 day prior to admission with history of multiple admission.
Anybody? Okay, let's say this, we say like this. This is 1 year, 2 month old boy who having shortness of breath for a day. So what does thing come to your mind?
Pneumonia, because the child have
Before that,
previous
what
optic contact.
what's this the issue? The question, the issue. What the question that come to your mind?
Respiratory infection.
Before that, what the thing come to your mind?
Congenital
This is
problem.
a 1 year and 2 month old boy who are having shortness of breath.
Any previous congenital problem?
Start the W.
Wheezing?
The questions in your mind, you know. Questions, not the need. All you do give the question mark.
Is this an emergency or non-emergency?
Well, before that,
So is it why?
You see in front of you the child. Wah, budak ni ada shortness of breath. What comes to your mind?
Severity of the
Severity is part of the issue.
What's the possible diagnosis of this patient?
What the diagnosis or cause? What the cause of the shortness of breath in this child? Naturally, what? Now, this is a step of thinking process. Bukan itu fikir diagnosis, bukan itu fikir severity, ni semua. You tengok pula tu, what the cause? Because even you want to treat severity pun, you have to figure out what the cause. So what's the thing come to your mind? What the cause of the chest having shortness of breath? What the next thing come to your mind?
Infection.
Before the infection.
Foreign body aspiration?
Before all those things, so what the cause of the shortness of breath in your mind? What's the thing yang mesti ada dalam mind you sebelum you attending this patient? The knowledge that you should have.
The criteria how to diagnose asthma.
Is it a cardio or respiratory problem?
It doesn't matter. But before that, what the thing that you must have in your mind? Ada panas ni. Dah buka kipas je. What thing come to your mind?
I also want to know if this is the first presentation or already multiple presentation.
Apa nama tadi yang suruh keluar tu? Hani, apa nama dia?
Muslihana.
Okay. What will come to mind? What the thing come to mind is, what the thing you must have is the causes of shortness of
breath.
I mean, the principle of thinking is like that. What you look at the child, you say, oh, what the cause of having shortness of breath? And you have to have a list of causes inside your brain. Before you can only then you have the adequate knowledge. It means that you have to have adequate knowledge. Then you can attend your patient with your, already you have the knowledge inside your brain. So what is the possible cause of shortness of breath?
It can be upper respiratory.
When you're talking about list of causes, you give list of possible diagnosis. Apa?
It can be infective or non-infective. Infective, for example, pneumonia or viral bronchiolitis.
Where you can get all the list? We're going to get all the list. Where you can get all the list?
Buku.
Yes, in the book. Or nowadays where?
Online websites
online.
that's up to date.
Google je. You can Google everything now. So knowledge is not a problem anymore. It's a matter of you want to read or you don't want to read. So you read the book to solve this patient problem of having shortness of breath. The book only tell you the list of the cause and the possible sign and symptom. Because the book tell you, but your real book is the apa?
Patient.
Your patient with the sign and symptom. From there you decide from your knowledge what you have known and compare it with the patient to make a what is possible causes. When you know your causes, only then you can solve the patient problem. So that's why you read the book. If you read your book to pass the exam, what you get? You only get passing exam only. That's all. If you read your book to solve the patient problem, you will get the knowledge to solve your patient problem. You nampak the difference tak? Which one will make you remember more? Which one yang akan menyebabkan ilmu tu berkat?
The letter.
Patient.
To decide lah.
Patient's problem.
While you read the book. So you wonder why some people can remember for a long time, some people can remember for a short time. Kalau benda tu berkat, lama tak dia ingat? Lama you ingat, become part of you. So kenapa you baca buku? Sebab kita takut nak marah lecturer. Sebab apa? Sebab exam MCQ, PMP. Exam is only to assess your you adequate, not adequate, that's all. You do exam for what? Apa you tengok exam tu? Exam tu tengok as for passing je. Tak pass, kalau fail menangis-nangis. You tak pernah, kalau you fail mean that you have not yet have adequate knowledge yet. You tak pernah macam tu. What's your opinion of exam? Ada opinion? Daripada darjah 1 sampai sekarang semua exam saja. Sekejap exam darjah 1, darjah 2, darjah 5, darjah 6, form 1, form 2. Hidup dia sampai besar penuh exam saja. Exam. Sebab tidur pun bukan mimpi exam . Seksanya lah hidup . Hidup sekali je. Tapi semua sentiasa kena exam. You don't look exam as a test to see positive. You can look exam as a negative aspect or positive aspect. If you look at exam is to look to see that you have adequate knowledge or not, or you do an exam as a boundary, as a satu penghalang cita-cita you. Mana you tengok exam tu? Kalau untuk tengok exam tu as something that just to test your knowledge adequate not adequate. If I feel you mean that I don't have adequate knowledge yet. You rasa susah hati tak pasal exam tu? Susah nak tukar prodigal for mine . Your form 5 belajar tu belajar gila-gila ya? Belajar gila-gila form 5 tu. Tak. Oh, enjoy. You relax lah. You banyak relax lah. Ya. Tak apalah. Itu kehidupan. You sampai tua besok ke exam. Sampai my age pun, at my age you kena ambil orang exam. Lagi tension. You tahu tak? Setiap 3 bulan ambil orang exam. 3 bulan orang exam. Sama teman-teman ambil orang exam. Dulu kita ambil orang, kita pergi exam. So kita ambil orang exam pula. You rasa siapa lebih tension? Orang yang ambil exam ke orang yang assess you ambil assess you yang mark you exam pass or fail? Siapa lebih tension you rasa?
Dua-dua.
Dua-dua. Dia lebih tahu tak? Bukan, memang ada dua tension. Siapa lebih? Lebih cannot be equal. So my message to you is, you see, kalau you rasa if you want to sakinah, tu sakinah, aman, you change your motive of doing things. If you think you want to read because you believe that this reading will help you to solve the patient problem, you will get your sakinah more. If you baca buku tu because you want to pass the exam, you takkan tenang. You takkan tenang. You rasa tanya dia dah habis baca ke belum ni semua ni tak tenang. Tapi whose choice is that? Whose choice?
Individual choice.
You decide lah, it's your choice. So the concept only today, I just want you to learn where you want to put your reading is. Where you put your reading is. You see your patient come with chief complaint. And then you want to know the cause. Why is it the child cause? Then before you can proceed further, then you will become much better in making decision if you have adequate knowledge. Then that's why you insert your knowledge. You sit down, you look at the core, everything semua, you'll have your list of possible cause, and when you clock your patient, you see that's the reason between different me and you. I can sit down drinking, listen to your AC on site, I already can figure out already the patient problem. Because my brain, I already have a list of things that I want to know. Because inside the brain, I have the list of the thing of possible causes. Like this case, can I exclude heart failure in North-Africa case? No, nothing mentioned about the symptom of heart failure. Nothing. I looking waited, so because in my brain, I already have the list of the causes. List of the causes. So this is inside already. That is proactive thinking. And you enjoy more listen the history. You're going to enjoy listen the history because you already have something inside your mind what you want to know. And that's come with your reading, where you want to put your reading. And believe me, you enjoy more in medicine. Tak stress, relax je, cool je. Cool, relax je. Because you already know what you want to know. This case shortness of breath. Okay, dia ada list. This started 4 months ago. Your list become smaller 4 months ago. Coughing was 4 months ago. Jadi already dah smaller you punya possible cause. Okay. Tak muka your attention semua. Tapi lah, we cannot optimize the teaching until you see your patient. Because your patient is everything. For a doctor, nothing else in their life when it comes to their profession, it's all about your patient. Imagine you want to learn medicine without seeing your patient. Actually, I tak minat nak mengajar pun clinical without seeing the patient. What to do? We don't know how long going to be. So we try to find the best way lah. You kena otak, you kena buat simulated lah. Dan kalau you ada adik-adik yang you examine your practice your examination, because important you lost your examination skill though. It's easy. It's not easy to get back to get the skill, but it's easy to lose it. You lost it very fast, but to get back the skill, it's going to be quite tiring. Okay. Ada pun nak tanya? Kenapa Azura muka sedih sangat apa?
Doktor nak tanya. For my case just now, so patient kan presented with shortness of breath, noisy breathing, and then cough for 1 month. So nak tanya juga ke the symptom? I mean nak tanya juga ke symptoms yang might suggest heart failure as the causes of the shortness of breath?
You mean apa tu patient with heart failure kena cough for a month? You mean patient heart failure kena have lethargy, weak, kena have shortness of breath, slowly become shortness of breath for a month. You mean you cannot get that?
But the cough is usually not yellow with yellowish sputum, isn't it?
1 month, 1 year, 2 months, you tak tahu. Usually their sputum is not valid. Only 6 years, only the child can cough out sputum. The child maybe have heart failure, coughing with some shortness of breath, then develop secondary pneumonia. That's why they become the shortness of breath become more severe.
Okay, faham.
Any other question?
Doktor, yang first case tu kan kita assume as mild kan, tapi maksudnya kita tak
mild. I didn't say mild. I didn't say mild. I didn't say moderate. I don't say severe. I just quiet only.
I mean macam as a doctor kita tengok kita mesti worry about the complications. So, macam if we suspect it's specifically that diagnosis because we know the complication, wouldn't that wouldn't that we require kita untuk bagi prompt treatment?
Yeah, we need to prompt treatment. We need the question is that how the patient is during the admission. Clinically, I didn't ask what happened if you don't treat promptly. What you see is better of your argument. You understand or not? Did I say you're right? Did I say you're wrong? No. Did I say you're wrong or not? No. Did I say you're right? No. Why? I just want you to test your become lawyer. To defend your
argument.
So you want to say something, you must something already inside your mind. What is you want to say about? I don't want you become reflexology tau. Tu lepas, lepas tu tak tahu nak defend. I didn't comment anything. I tak cakap pemahaman moderate or severe. I didn't say yes you're right, yes you're wrong. Do I say that? No. I want to see how you defend your argument. Because the more you defend, the more deeper your thinking is. That's all.
Tapi doktor, kalau kita orang defend but it turns out that our answers are wrong?
No, I just show to I just pusing the argument. Did I say you're right or wrong? I just pusing the argument, to see how strong you are in your stand. Tapi you pusing sedikit saja dah pusing sedikit je tumbang lah. Pusing sedikit je dah give up dah. Only a few I've seen students who are very strong with the argument. Dia pusing balik, dia pusing balik, pusing balik. If you're wrong, you're right, I will say so. If you're wrong, you're right, I'm going to say you're right, you're wrong. But I didn't say anything. I just want to see how strong you are in the defending your argument. So you should realize your argument is right or wrong by yourself. Okay, ini ada question. Okay, finish.
Doctor, for the next week is at 11. Nak inform dia orang.
11 ke 12? Teaching apa?
Based on dapat message.
You block 1 kan?
Saya kita orang block 1 group 1 sebab yang group tu.
Tapi you ONG sekarang kan?
ONG.
So because this one is how many? I think I have ada teaching lagi dan you all tak ada kan untuk sampai you face to face kan? You suppose face to face bila tak tahu? Sebenarnya I confused about the timetable. Don't worry lah, not only you, I also confused about the timetable. I will tell you, I tak tahu banyak sebenarnya. How many teaching I miss from you all? You tahu tak? You pun tak tahu.
Kalau online teaching dengan Dato untuk group untuk subgroup kita orang dah tak ada dah.
Ada dah
face
kan?
to face tak ada dah.
You come face to face. So I too strong. I betul-betul confused about the ni. I buka-buka. I kadang I punya I tak tahu dalam I punya diary sampai 3 benda satu hari tu because dia tambah. Tahu I cakap, hai macam mana banyak sangat ni. Tahu. Because I don't know because the program keep changing tau. Suddenly sekarang CMO dah tarik balik certain state. Lepas tu certain state naik balik. So we don't know. I cannot ni. So I now I finish with you all, is it? Tak ada kan? Until the face to face. Yang pukul 11 tu next week tu ada apa? You cakap ada apa?
No. Pukul 11 hari ni sebab Dato' ada lagi dua
lagi. Yalah. Because I kena bayar, I kena buat satu-satu because I boleh lah for the first beginning tapi lepas tu I rasa tak ada patient tak best. Tak ada patient tak best. Okay. Pukul 11 dia lagi. Yalah pukul 11. Okay lah. 11 lepas tu my wife dah complain dah kata cuti Sabtu tapi mengajar. Tak apalah. Macam mana kan?
Dato' kalau ada yang tanya kalau dari subgroup lain nak join session pagi tu boleh ke?
You see my teaching is very personalized. You notice tak? You faham tak? Kalau 20 I cannot concentrate.
Alright.
Actually I prefer smaller group.
Nanti saya inform dia.
Yes, lagi smaller lagi better. I prefer 6 sebenarnya satu group. So we can have very intense brainstorming. Sekarang tak sangat. Okay. 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 Okay.
Sorry Dato', boleh tak kita dapat markah untuk CC hari ni?
Itu you muka you tu tunggu markah lah tu.
Tak, bukan takut tak dapat kontak nanti. Tak.
7, 7, both of you.
Thank you Dato'.
Okay. Okay.
Thank you so much.
Bye. Thank you Doktor. Assalamualaikum.